Hey, future medics, Tina here, your medic mentor, and today we're talking about a well-known medication in EMS, naloxone, better known by its brand name, Narcan. Narcan is an opioid antagonist, meaning that it kicks those opioids off of the receptors in your brain. The problem with opioids is taking too many can stop your patient from breathing. So by popping them off of those receptors and plugging those receptors up with Narcan so the opioids cannot rebind, your patient will start breathing again, possibly even wake up. So when are we using this? Anytime we suspect an opioid overdose, which can look like pinpoint pupils, decreased level of consciousness, or decreased respirations or absent respirations. Thing to remember is we can safely treat and transport people to the hospital without waking them up. People who suddenly get jolted awake from an opioid overdose are often very violent, and the ambulance is just not set up for a wrestling match. So we want to protect their airway and get them breathing again because airway is king always, but we don't want to wake them up. So titrate your dose to do that. The adult dose is 0.4 to 2 milligrams, and this can be given IV, IO, IM, or IN. You can keep repeating doses until you have the desired effect up to a max accumulation of about 10 milligrams, but people usually respond with 1 to 2 doses. The onset is 1 to 2 minutes, and the duration is 30 to 90 minutes, which is important to keep in mind because some long-lasting opioids last longer than 90 minutes. So if you have a long transport time, you might need to redose this because the Narcan will wear off and pop off of the opioid receptor, taking the cap off, allowing the opioid to bind to that receptor again, and your patient will stop breathing. Side effects include nausea, vomiting, agitation, tachycardia, and seizures. Pulmonary edema and hypertension are possible, but rare. Now, for your contraindications, there aren't any. If you suspect that somebody has had an opioid overdose and they are not breathing, use Narcan. Just be aware, if you wake them all the way up, they could be very violent. But here's your takeaway. Narcan is a great tool, but it is a bridge to get to the hospital. It is not the cure. They still need definitive care, keep a patent airway, and might need to be ventilated. But that's it. That's another one knocked out. You're doing such a great job. I'll see you for the next one.